Kishore really covered it all when he spoke about how Canada is with orthopedics, and I echo everything he said. Kishore and Mo, is just an honor to work with them, and I think we're hopefully doing some great things within Canada and around the world. So what I wanted to talk to you today a little bit is about women in orthopedics and gender diversity. And it's interesting how Kish talked about the COA being instrumental in getting him into a lot of the leadership roles that he has. And the COA was also instrumental in getting me involved in diversity, because I think I was just ticking along in my career. I was interested in leadership positions. I pursued that with the COA, but it was really the COA executive when I joined that pushed me to look more into the diversity aspect, particularly gender diversity. And it's just blossomed from there, because I really figured out how little I knew about it, despite the fact that I lived it. So I'd like to share a little bit of that with you today. These are my disclosures with regards to diversity, with which Richard has pretty much gone through. But why is diversity important? And we all hear about it. It's got huge momentum around the world, not just in medicine and not just in surgery or orthopedics, but this is what you're hearing about all over the world, about diversity, not just gender diversity, but all types of diversity. And the reason it's important is really because it drives innovation and it drives thinking outside the box. So if you have a whole bunch of people who are all had the same upbringing, they all look the same, they all went to the same school, they're not going to come up with new ideas. But if you're facing a problem and you have a group of people that all have different life experiences, have come at it from a different way, you're going to actually get great new ideas and think outside the box. And study after study has shown that when people work in a dynamic environment like that, they're happier. And so your people are happier, which means everyone's happier. And when you look at healthcare, many studies have shown that if you have a diverse healthcare working group, you actually give better patient care. So there really is no need to make a case for diversity. The case is already made. So diversity makes everything better. So what I'd like to review with you a little bit today are these three things. I want to talk a little bit about gender parity in orthopedics. And so people have an overall view of where we stand. I think it's hard to look at change in the world or understand what change needs to be made if you don't know what the state of the union is. We're going to look a little bit at barriers to gender equity. And I think this is where a lot of people don't truly understand the depths of some of those barriers. They just don't want to see them, but they're hard to see unless they're pointed out. And then I really want to end with some practical strategies of how we can improve things and create a culture of equity inclusion where everyone can thrive. So the first question always is, what's this gender gap? Everybody's talking about a gender gap. What is it? Come on. If a girl wants to apply for orthopedics, she can apply for orthopedics. They do the same interview. Everything's the same. If you want to apply for a job, you can apply for the job. So is there really truly a gender gap? Well, let me show you some data and see if I can show you. So this is data from 2020, so recent data from the American Medical Association. And so these are all the medical specialties. And sorry, your guys' faces are there. So the x-axis is actually our representation of women. So this line shows where the specialty would have 50% women in it. And I'll just preface this by saying that at least in Canada and the US, medical schools are now 50% or greater females going into medical school. So we're starting in medical school at 50-50, male to female. Here's our 50-50 line for the medical specialties. And the ones I bolded there in yellow, those are our surgical specialties. So if you want to search for orthopedics on there, I can tell you to look way down at the bottom. This is recent data from last year, orthopedic surgery right down at the bottom for gender parity. And this is representation. So we do have a long way to go. What if we look at orthopedics globally? Again, Kishore has showed us that we need to have a global look at things. This is data from WOW, so Women in Orthopedics Worldwide. And this is data that we gathered, at least from everybody we could get the data from. And I'm very proud to say on this graph, number 4 is Canada. So Canada is actually doing really quite well. But remember, right now, Canada has 57% women in medical school, and we still only have 12% orthopedic surgeons. And the newest data actually came out, I have 1 year newer, is 13.6. So we're slowly creeping up, but that's taken over 20 years to get that far. And probably even a little bit more disturbing is if you get down here to number 6, we're already below 10%. So even the top 6 countries in the world, 26% is the most, but you get 6 countries down and we're below 10%. Even more concerning, if you look at it just a little bit different way, this is a heat map. And here we've colored the countries according to their number of female orthopedic surgeons. And this is recent data. So again, you can see Canada is doing pretty good. Northern Europe is doing pretty good. But what bothers me the most on this map is look at all the white space. So all those countries that are white, we just don't even have the data of how many female orthopedic surgeons there are in that country. So how are we supposed to institute change if we don't even have the baseline numbers? And the numbers we have are not that exciting. So this is where we're coming from. So I'll ask again, do we have a gender gap? Well, I think for female representation in orthopedic surgery, there is definitely a gap. And we need to do better with that. And many countries are. But what else is a gap for women in orthopedics? Well, the studies show women receive less pay. They get fewer promotions than men get. When they apply for research grants, they get fewer grants. And the grants they do get are for less money. If you look at the publication record, women publish less papers. And on top of all that, they have higher rates of burnout and higher rates of suicide. And this has been shown in study after study, after study, after study, after study. So this has been well shown in the literature. And the reason is that at every single step of their career, from medical school to residency to fellowship to getting a job to advancing in that job to getting paid, women face discrimination at every stage in their career. And it's not that other people don't face discrimination, but women face it more than others at every stage in their career. Pretty sobering. Let's look at it a little bit closer. So these are women in leadership positions. So again, our leaders make the rules, the leaders are role models, and the leaders create culture. This is American data. So American data from 2021. The orange bars are female, and the blue bars are male. So you can see this is rank in academic orthopedic departments. You can see at the rank of professor, very few women. And only 6 of 120 chairs of orthopedic departments were female. Here's the Canadian data. Remember, I was bragging that we're pretty good in Canada. Well, if you look at the academic rank, this is a little bit flipped. We got professors on the right side now, but as you increase in rank, so the higher up you go in rank, fewer women there are. What about pay gap? Many people find this very confusing. If I do a fractured forearm and Kishore does a fractured forearm, the fee schedule would be the same. But there are actually a lot of things that go into a gender pay gap. This is Canadian data from 2020, actually from Ontario. And the line you see, vertical line, would be equal pay. So that's a ratio, and a ratio of 1 to 1 means men make equal to women. And again, if we look at our surgical specialties, I've highlighted, and orthopedics down at the bottom, in Ontario, a male orthopedic surgeon makes 1.57 times a female orthopedic surgeon. And this is across all the medical specialties and the surgical specialties. And again, it's probably a whole day course to discover the reasons behind this. But again, this is data. Most of the studies about gender gaps talk about lack of mentorship. So when surveyed, female physicians consistently say that lack of mentorship is a problem. So we don't have many female surgeons, female orthopedic surgeons. They don't have people to look up to. And this is a problem, and it's improving greatly. But women can mentor women, but men can also be excellent mentors for women. All my mentors were men, and I did not feel left out. And I think if men can intentionally mentor women, that will help. But it tends to be that men are easier, or male residents are easier to mentor for men. And that's because people like hanging out with people like them. So again, intentionally mentoring people, someone who is not like you. Sponsorship is hugely important. Mentorship is a big commitment. That's a commitment to a relationship, but sponsorship is hugely important. Sponsorship is Kishore asking Laurie to help come give this talk. So it's a one-time deal that you can really put somebody forward. These are some of my mentors and sponsors. These are the surgeons I did fellowship with. So this is my little fellowship posse. But sponsors will expand your network. They'll give you opportunities. If there's a paper that needs to be written, they'll ask you to come help. So you can sponsor someone, and it's not a huge commitment, but you can intentionally sponsor someone who's not like you. No talk about discrimination is complete without talking about bullying and sexual harassment. And this really can take many forms, even very insidious forms of discrimination where it's just a little comment, up until things that we like to think don't happen, but probably happen. This paper was written by a British friend of mine, orthopedic surgery registrar, and this was just published in the British Medical Journal or British Surgical Journal. And it's an excellent review of sexual assault in surgery. And I actually encourage everyone to read it because you will be very shocked, but I think it's really good to know that these things are out there. And really the standard we walk past is the standard we accept. So we all see things, we all hear things, and really until everyone stands up and doesn't allow these things to happen, things that we know are unacceptable, this kind of behavior will continue. One of the other issues is a bit more social, the unequal division of labor at home. All social norms in most countries, and for sure in North America, assume that the woman bears most of the burden of childcare and elder care and house cleaning. So again, social norms make that very difficult for female surgeons because when they finish work, they go home, and even when both partners are working, women tend to do 3 times the domestic work as men do. So again, that really places a burden on women, but it also devalues the vital role that men play in taking care of the home and being with their children. So that all is very depressing, but how can we change culture? And culture is changing. First, programs like Break the Bias. So this is just last week. Programs through IOTA, through WOW, through International Women's Day, and all the intentional education about the bias is really important. Be a sponsor, be an ally. So I think if you're wanting to help, find someone who doesn't look like you, someone who looks like they could use a sponsor or maybe isn't getting them the same way, and you can be a sponsor and ally. Kishore is an excellent example of this, as is Mo. And again, Kishore put his picture in for this campaign, this advocacy campaign. And again, putting it out there and letting people know that you are supporting diversity is so important. And having zero tolerance for any discrimination or bullying. What are a few strategies for women? Well, I think if you're a female in orthopedics, there's not that many others around you. So know that you're not alone. Join IOTA. Try to get involved in, there's many women's groups, national women's groups now in most countries. You can join them. You can find friends, you can share your stories. There's a lot more women in orthopedics now, and you are not alone. Find yourself some mentors. You may need to be proactive, but don't be narrow. Your mentor does not have to be a woman. You can have excellent male mentors also. And think of sponsors too. You don't have to have a big commitment from someone to just ask them to sponsor you or try to work on a sponsorship relationship. So that's it. Thank you.